Babies sleep a lot, and there are certain things you can do to make sure they stay safe during their sweet dreams, as recommended by the American Academy of Pediatrics. Learning how to put your baby to bed safely will greatly reduce the chance of sudden infant death syndrome, known as SIDS. We don't know exactly what causes sudden death in healthy sleeping children under the age of 1, but we do know what the risk factors are, including exposure to secondhand smoke, sleeping on their stomach, sleeping on a soft surface, getting too hot while asleep, sharing a bed with an adult, and sleeping on or under loose bedding. That's why it's very important to always follow the ABCs of safe sleep. A is for alone. Babies should always sleep alone in their own bed. Never let the baby sleep in the bed with you. It's okay to share a bedroom, but not the same sleeping surface until the baby is about 1 year old. In fact, sharing a room with your baby, but not the bed, actually decreases the risk of SIDS by as much as 50%. Only bring your baby into the bed to feed or comfort. You should remain in an upright position to prevent yourself from accidentally falling asleep. Place the baby back in his or her safe sleep space when you're ready to go to sleep. B is for back. Always place the baby on his or her back on a firm sleep surface, such as a crib or bassinet, with a tight-fitting sheet. Do not put blankets or pillows between the mattress and fitted sheet. Babies up to 1 year of age should always be placed on their backs to sleep for naps and bedtime. Tummy time when your baby is awake is an important part of your daily routine to help develop head and neck muscles and should be supervised by an adult. C is for crib, which should always be completely empty except for one fitted sheet. Don't use soft bedding, including bumpers, blankets, pillows, and soft toys. These items increase the risk of suffocation or strangulation. Since no blankets should be used in the bed for the first year, keep your baby warm using a sleep sack. These are safe and have shown to lower the risk of SIDS. Also, one-piece clothing is safe sleep attire. Swaddling is another way to provide soothing comfort at sleep time, but as soon as your baby starts trying to roll over, it's important that you stop swaddling. If your baby falls asleep somewhere other than the crib, such as in a car seat, stroller, infant carrier, or infant swing, move him or her to a firm sleep surface as soon as possible. Be sure to keep the baby's sleep area cool to avoid overheating. If the room is comfortable for an adult, it should be just right for baby. Never put your baby to sleep on an armchair, sofa, waterbed, cushion, or sheepskin. Positioning devices are not safe and should not be used. It's good to offer pacifiers at sleep time, and it's okay if your baby doesn't want one. If the pacifier falls out after your baby falls asleep, you don't have to put it back in. Using pacifiers during the first few years of life doesn't cause long-term dental problems. However, prolonged use might cause a child's teeth to be misaligned or not come in properly. Now let's review the ABCs of safe sleep. A is for alone. Babies should sleep alone in their own empty crib or bassinet. Never sleep with a baby in your bed, but sharing the same room has benefits. B is for back. Babies up to 1 year old should be placed on their backs for nap time and bedtime on a firm sleep surface. Use tummy time when the baby is awake to increase head and neck muscles. C is for crib, and it should be empty except for one fitted sheet. Always put your baby to bed in the crib. Room temperature should be cool and comfortable, and to keep baby warm, use a sleep sack, onesie, or swaddling. Remember, once the baby tries to roll over, stop swaddling. Offer a pacifier to help in falling asleep. And finally, there should be no smoking around babies. Children's of Alabama and the American Academy of Pediatrics want to help you give your baby a healthy and safe start in life. And safe sleep is the first step. If you need more information or have any questions, please go to aap.org and search Safe Sleep. Sweet dreams.